IPAN prides itself on doing research that makes a difference. And since we became a research institute, we've been able to employ new staff with an increased focus on secondary prevention and also implementation science. Major focus for us has been on multidisciplinary research, so that our researchers within IPAN can work together to come up with innovative solutions to improve the health of all Australians.
My research ostensibly focuses on how we can support families, particularly families with young children, to get the best health across their life through good nutrition. I work in this space because I guess prevention is my passion, and if you look at where disease comes from across our life, we can feed back a lot of that to what happened to us in utero when we were babies and across the first 5 years of life. What happened to us in terms of our diet in that time seems to be critically important. So if we want to prevent lifestyle diseases like overweight and obesity, cardiovascular disease, lots of cancers, then we need to be looking at what's happening in the beginning of life. So the big picture goal for early childhood nutrition, for family nutrition research, for me is really about how are we going to continue to be able to talk to the people we need to talk to, particularly those who are most at risk of nutrition-related disease. How are we going to reach them? And of course, new technologies, things like the web and phone apps are a really important part of that. So understanding how we can do that really, really well is a key focus for me at the moment.
My research area is focused on dietary salt intake, and I'm interested in this because there's a lot of salt added to processed foods, and increasingly in children's diets they're having a lot of processed foods. So what I'm interested in is getting an accurate measurement of how much salt children are consuming, also developing strategies to try and reduce the amount of salt children are eating, and also what are the consequences in related to cardiovascular health of eating too much salt during childhood. Through our research, we hope to help families make better choices to improve their diets, in particular with salt intake. And we've done this by developing an online education program. And what we hope to do is offer practical strategies and advice so children and parents can actually make changes in their diet to reduce the amount of salt that they're exposed to. Through our evidence-based research, we hope to inform government, influence food manufacturers and consumers to reduce salt intakes within the community and ultimately protect long-term health outcomes.
So national data in Australia show that our children and young people are not doing enough physical activity to benefit their health. They're not meeting the current physical activity guidelines, and they're spending too much time sitting. So here at IPAN, we're conducting a number of studies that are looking at key influences on physical activity and sedentary behaviour, so we can understand why children are active or what's stopping them from being active. And we're also looking for simple solutions that are easily implementable in schools, in families and in the community to help children to move more and sit less. So this research can be used to help produce guidance that will help local governments and other agencies to create communities that are more activity friendly.
A lot of our research focuses on cardiovascular disease and its associated risk factors. A key focus of our research is accessibility, and we're really interested in looking at how we can use some novel technology platforms to overcome accessibility barriers and help us to deliver engaging and evidence-based interventions to a wider range of people. One of the big problems people have is that traditional treatments are quite difficult to access, and so people don't really participate in them the way that we would like. That's where we're hoping to use some really innovative technology platforms to help overcome some of those barriers by making the treatments available to people in the environments that they need them, rather than requiring them to come into the traditional clinical facilities.
My research is focused on understanding the dietary patterns and dietary behaviours of Australian adults. We know that dietary behaviours are a really important determinant of chronic disease risk and really important for preventative health. My work focuses on that, but also looking at the potential determinants or drivers of these lifestyle behaviours so that we can understand what influences dietary behaviours and how we might move people towards healthier lifestyles. So we've been doing research in young adults, people aged 18 to 30, and we've been looking at their dietary behaviours, so their dietary patterns over a number of days. And we've also been collecting data on a range of potential determinants or drivers of these dietary behaviours, so things like their personal factors around nutrition knowledge, some of the social factors, so some of the influence of their family and friends, and also some of the physical environment factors. And so we've been looking at those different range of determinants to see where is it that we might be able to influence young adults to move towards healthier lifestyles and consume more healthy foods.
Research has shown that parks are underutilised with quite low levels of people visiting our parks, and also our park visitors tend to engage in low levels of physical activity, with a large proportion either sitting or lying when they are visiting the park. Over recent years, I have led 2 natural experiments with colleagues in IPAN that have examined the impact of park refurbishment on park visitation and park-based physical activity. The findings from the natural experiments that we have conducted have shown increases in both visitation and physical activity after the park has been refurbished. Given significant forecasted population growth and high density living, the availability of high quality parks and public open spaces is critical for future generations.
My current research focuses on the effects of exercise on brain function in neurodegenerative conditions. Conditions such as Alzheimer's dementia or Parkinson's disease. We know that both these 2 conditions are the number 1 and number 2 conditions in elderly adults above the age of 65, and they present as one of the greatest financial and economic burden in that population of people. Currently, one of our projects is the use of virtual reality to prescribe exercise therapy for people with Parkinson's disease. The reason why we're using virtual reality is that virtual reality is very interactive in nature, which helps to improve exercise adherence. And also, we can prescribe virtual reality exercises remotely, which means that people don't have to travel as far to go to conventional forms of therapy, or they can practice their exercises at home as well. So it is with hope that using such an exercise delivery model can help to improve quality of life, reduce burden on not only the person that's living with the condition, but also financial burden of the healthcare system.
The chronic disease epidemic that Australia faces, that we're seeing occurring internationally, is a very complex problem. It's important that we're all working together to address this. IPAN has a lot to offer in collaboration with its stakeholders to deal with these issues, and I think working together, the future is quite bright.